Thank you for joining us today. As we continue to respond to the COVID-19 pandemic, the University of Maryland Medical System will be hosting these webinars periodically to ensure that our communities are fully up to date on what we are doing to combat COVID-19, as well as sharing steps that you can take to protect yourselves and help stop the spread. Our discussion today will be led by Dr. Mohan Santa, the President and CEO of UMS, and Dr. David Marcosi, our COVID-19 Incident Commander. Today, we are going to cover a variety of topics, including general COVID-19 updates and information about getting vaccinated. We'll also be joined by a special guest, Dr. Karen Kotloff from the University of Maryland School of Medicine. Dr. Kotloff led the clinical trial for the Moderna vaccine at the School of Medicine and is going to help us answer some of the questions we know that you have. It's my pleasure now to turn it over to Dr. Santa to get us started. Dr. Santa?
Thanks, Chris, and good afternoon, everyone, and thank you for joining us today. First, as always, we want you to know that you can turn to the medical system as a trusted resource for information on COVID-19, and you should always reach out to us if you have any questions. We'd also like to remind everybody who's listening that the University of Maryland Medical System has a free call line for our community and that it is available anytime, day or night. The call line is staffed by nurses and is available if you have any concerns or want to discuss possible symptoms related to this pandemic. You can reach the nurse call line at 1-888-713-0711. The CDC also has a COVID-19 tool on their website that you can use to evaluate symptoms that you or a loved one may be having. And finally, you can find tips on managing your health and your wellness at umms.org/COVID. Now, before we speak with Dr. Kotloff about the Moderna COVID-19 vaccine, I'd like to give you a quick snapshot of the situation at the medical system and across the state of Maryland. As of this morning, the medical system has 333 COVID-positive patients within our system. This is very close to the high point of 337 patients that we were treating actively last spring. It is actually lower than we were just a week ago, where we were coming close to 350 patients. Throughout Maryland, there are now 295,874 patients diagnosed with COVID-19. And the statewide COVID-19 positivity rate is 9.31%. Unfortunately, due to the holiday travel and gathering indoors, we across the system as well as across the state have seen a steady increase in cases since we last met together. And unfortunately, we expect this trend to continue as we are now in that window of 2 weeks post-Christmas and right in that window between Christmas and New Year's, that 2-week spread from that point in time. And despite this, I will tell you that there is still reason for hope and optimism. We now have not one, but 2 vaccines that have been distributed to our healthcare workers. And there are several more vaccines entering the home stretch of the FDA's approval process. As of this morning, our medical system has vaccinated 16,694 employees with their first dose of the COVID-19 vaccine. We've also vaccinated 315 of our team members with their second dose. And we have several thousand appointments scheduled for the coming weeks. It's important to note that these numbers are impressive, and it's also important to note that our workforce are choosing to be vaccinated, as this is not mandatory within our workforce. It is a choice that our team members are making as they've understood the science and they've understood their role in helping us get beyond this pandemic. So these numbers are incredibly exciting and show how far we've come since just a few weeks ago. But we also have a lot ahead of us, and so I want to ask Dr. Marcozzi, our incident commander across the health system, to walk us through how the vaccines are currently being distributed and what you can expect in the coming weeks and months. Dr. Marcozzi?
Thanks, Dr. Santa. Good afternoon, everyone. Good to talk to you all again. We are currently in phase 1A of the distribution process. Once our healthcare workers have had the opportunity to be vaccinated, we will move on to vaccinating our patients and other Marylanders throughout the state, according to the guidelines set by the Maryland Department of Health and the federal government, which are designed to be as equitable and fair as possible. After phase 1A, we will work through several additional phases that incorporate additional members of the community until everyone has had the opportunity to be vaccinated. The University of Maryland Medical System is allocating vaccines based on a national framework developed by the National Academy of Science, Engineering, and Medicine. These guidelines are designed to make sure the vaccine is allocated in a fair and equitable manner to those who have the highest risk of exposure to COVID-19. The next phase, phase 1B, will include those who are educators, essential government workers, and adults aged 75 and over. After that, we'll move on to phase 1C, which includes adults aged 65 and up, public safety, and healthcare workers not yet vaccinated, and other essential workers in critical industries such as agriculture, manufacturing, and transportation. Phase 2 expands access to adults aged 16 to 64 who are at an increased risk of severe illness due to multiple health issues or chronic illnesses. Other populations not covered in the previous phases, but who are at high risk for getting COVID-19, will also have access to the vaccines in this phase. This process will continue over the upcoming months and may continue to evolve as additional supply becomes available. And we will continue to provide updates as we move through the phases and more Marylanders have access to the vaccines.
So as Dr. Marcozzi mentioned, these are guidelines set by our state and federal governments and may continue to evolve as our operations and vaccination supplies expand. With all of this in mind, let's turn our attention to what happens when the vaccine is available more broadly. We know that vaccination is an important tool in ending this pandemic. But we also know that there is still some hesitation amongst members of our community about receiving it. Last time we met, we discussed and then hopefully dispelled some of the misinformation circulating about the COVID-19 vaccines. So now I'd like to dive a little deeper into two of the top concerns that we've heard. One concern we've heard is that the development of this vaccine was rushed and that steps were cut. And this is just simply not true. It's important to know that the development and approval process of COVID-19 vaccines were not rushed from a scientific perspective. Administrative steps were shortened or completed at the same time, side by side with each other, but no safety steps were skipped. These vaccines have undergone the same in-depth review process as any other vaccine before them. Another common concern is that getting the vaccine could cause serious side effects. There are some mild side effects associated with this vaccine, as is the case with any vaccination. And the side effects most commonly are a physical demonstration that your immune system is responding as it should. The vast majority of side effects associated with the COVID-19 vaccines are minor, such as pain at the injection site. Some mild symptoms like fever or headache or chills or fatigue can occur, but they typically go away within 24 to 48 hours. A perspective that we hope can help address some of the concerns is that now in our health system, as I mentioned before, we have vaccinated approximately 17,000 employees, team members across our system. And of those 17,000, less than 1%, only 0.16%, have had any reaction that required any level of escalation in care or increased observation for anything beyond what is routinely done with this vaccine. These reactions all occurred immediately following the vaccination and when the recipient was still being monitored by the staff. So we've established response protocols at all of our vaccine centers to be prepared for any potential side effects, but we are incredibly thankful that we just aren't seeing them with any frequency. Less than 1% of the 17,000 provides you objective information about these side effects. Deciding to receive the COVID-19 vaccine is an important decision for you and your families. And our aim is to not rush you into a decision, but to let you make an informed decision, and a decision that is informed by science and by facts, so that when it comes time for your turn, you'll be ready to make that decision and hopefully choose to get vaccinated. One of the most important messages that has helped carry our communities through this pandemic is that we are all stronger together and that we are in this fight together. And all of us have played an important role in protecting ourselves, our families, our neighbors in this fight against COVID-19. Receiving the COVID-19 vaccine is another important way that we can work together to end this pandemic. The sooner we get vaccinated as communities, the sooner we can attempt to return to our normal lives. Right now, the best thing to do is to prepare for vaccination by understanding the vaccines and looking at all the information that is available. So I'm pleased to say that we think that attending this webinar is a great step. Then I am going to ask that everybody be patient. And when it is your turn to get vaccinated, you do so as soon as possible. To stay on top of the latest news, you can sign up for text message alerts from the state regarding vaccination updates. Additionally, you can visit Maryland's COVID link websites for the latest news and information. And of course, there are always resources available to you at umms.org. And if this has any bearing on your decision at all, I want you to know that I'm proud to share with you that this week, Dr. Marcosi and myself received our first doses of the COVID-19 vaccines. As physicians, as healthcare executives, when it came our turn to be vaccinated within our workforce and as part of our team, we were excited to join the thousands of the medical system team members who have already received their vaccination. I will tell you then when it was my turn, I did so having understood the science, and also understanding my responsibility as a physician to my patients, as a healthcare executive to our communities, but also as a father, as a husband, and as a son of elderly parents. I viewed it as my collective responsibility. Now, before we get to our guests, let's talk through some additional concerns that we've heard from our community. Specifically, those community members of our Black and brown communities. Many members of these communities are feeling skeptical about the COVID-19 vaccine for a number of reasons that have to do in part with the history of who we have been as a nation and the history of ethical violations in medical research and other injustices that still affect health outcomes today. And we need to recognize this concern and acknowledge the skepticism. But in part, it is why we are trying to spend time providing information so that our communities, especially our communities of color, can feel confident in these vaccines in the way that other parts of our communities feel confident. And it is, in fact, always mindful to me, I always try to be mindful that it is a statement about how we need to evolve as a community, that we have some parts of our communities wanting to know how quickly they can get vaccinated, while we have other parts of our communities that remain quite skeptical. So I'm going to ask Dr. Marcozzi to begin by addressing one of the most common concerns we've heard. Marco?
Yeah, thanks, Dr. Sunsa. And absolutely, I want to clearly confront the concern that the vaccines aren't safe for Black and brown people. That is not true. They are safe for Black and brown people. These vaccines went through an extensive process to confirm that they are effective and safe for use in many different populations. Even though this process happened quicker than usual, no safety steps were skipped. When we study these vaccines, we look at safety and effectiveness in a wide variety of people across our country. That's why the vaccine trials required that participants be high risk, have an underlying condition, or belong to a specific racial or ethnic group. The FDA has given these vaccines what is called emergency use authorizations, or EUA. The EUA helps us to get treatments and vaccines to the public during public health emergencies like this pandemic. During the EUA process, dozens of independent experts reviewed clinical trial data related to minority populations and high-risk individuals. EUAs are not uncommon. In fact, the FDA has issued EUAs in the past during other public health emergencies. Dr. Santa, I'll turn it back to you.
So thanks, Marco. And as you've noted, clinical trials encompass a wide range of demographic groups and individuals who vary in age, race, and underlying health condition. As I mentioned before, we have to recognize that there is a complicated history in this country when it comes to medical testing on Black and brown communities. And in part, the way these trials were conducted represents the efforts of our nation to recognize mistakes of the past and to conduct these trials ethically and under rigorous oversight, and to ensure that we included a wide range of members of all different communities throughout this nation and throughout the world, people with different demographics and different health backgrounds. When you look at, for example, the Pfizer clinical trial, where more than 37,000 participants were included. Just under 10% of the participants were Black or African American, 28% were Hispanic or Latinx, and 21% of the participants had at least one underlying health comorbidity, a disease such as diabetes or obesity. And the study was designed purposefully to study a wide range of community members to ensure that we understood and answered the question whether the vaccine was first safe, whether the vaccine worked, and did it work effectively in all of the communities that we studied. On the Moderna trial, similarly, again, 30,000 participants on this trial. 20% were Hispanic and or Latinx. 10% were Black African American. 25% were 65 and older. And again, in both the Pfizer and the Moderna trial, the vaccines were proven to be safe and effective for all of the participants, all of the demographics that were studied, all of the breakdowns. There was benefit to being vaccinated. So again, thousands of people across all of these demographics and backgrounds bravely volunteered to participate in these trials and establish that these vaccines are safe and effective. And we thank them for their commitment to our communities and their spirit of volunteerism that was demonstrated. One last perspective that I think it's critical to discuss when we talk about the decision about whether to be vaccinated or not. We also have facts as to the risk of contracting COVID-19. And we know that our Black and brown communities are at higher risk in this nation of contracting the disease. And if members of our communities contract the disease, members of our Black and brown community are nearly 3 times as likely to die of the disease. And so that is just, again, an important perspective that must be considered when we are all thinking about the individual decisions that we're making regarding vaccination. Marco, I'm going to turn it to you.
Yeah, thanks, Dr. Santa. Along those lines, we're hearing a lot of other questions that around why aren't Black and brown people first in line for the vaccine if we know they are potentially the most harmed by the virus in the United States? While the allocation process can be a bit confusing at times, I want to reassure you that we are working to ensure that the process of vaccinating our entire state is happening in the safest and most equitable way possible. UMS and many other health systems across the country are using frameworks developed and approved by experts at the state and federal level. These guidelines exist in order to ensure that no one cuts the line and that the vaccine is allocated ethically across all populations while still in limited supply. The goal of these allocation strategies is to vaccinate those at the highest risk of exposure, which is why frontline healthcare workers were included in the initial phase. Planning is very much underway to get these vaccines out to our communities, and we plan to move through these phases as quickly as possible.
So another question we hear quite a bit is, do I need the vaccine if I've already had COVID-19? Yes, even if you had COVID-19 in the past, you can and still should be vaccinated when your time comes. Although we don't know exactly how long, there is no risk in getting the vaccine, even if you have these antibodies that come after you've had COVID-19. The CDC suggests that those with a recent COVID-19 infection within the last 90 days may choose to delay the vaccination. But their recommendation comes so that others who have higher risk can be vaccinated first, while our vaccine supply is still somewhat limited. But to be clear, you should still ultimately be vaccinated. Our goal is to have as many people vaccinated as possible, and that includes those that have already been infected. Many of our workforce getting vaccinated have already been infected, and there is still no adverse reaction associated with being vaccinated if you had previously had COVID-19. So now that we've dealt with and hopefully dispelled a few more myths, I'd like to welcome an expert on the Moderna vaccine. Dr. Karen Kotloff is a professor of pediatrics, medicine, epidemiology, and public health at the University of Maryland School of Medicine. She was also the principal or main investigator on the Moderna clinical trial. Dr. Kotloff, thank you so much for joining us today. And I'm hoping that to start, we could maybe take a step back and just hear a little bit about how all of this started. When were you approached to lead the clinical trial on the Moderna vaccine?
Well, good afternoon, everybody. Can you hear me okay?
Yes.
Okay, wonderful. Well, thanks so much for having me here this afternoon. So, I have been testing vaccines in clinical trials for my whole career, and that's spanned more than 3 decades. And since around 2006, I've been leading a grant from NIH to run a vaccine treatment and evaluation unit at the University of Maryland School of Medicine. So we test lots of vaccines that are needed for public health emergencies and for people in developing countries and for people in the U.S. And so I'm very familiar with the stages of vaccine development. And it's a very, these days, regulated process. We go from phase 1, which is the first time you give a vaccine to people, and you give it to very few people and look to see if it's safe, and phase 2, which is larger numbers of people, and finally phase 3, where we look to see if the vaccine is capable of preventing disease. And it's the phase 3 studies that led to the emergency use authorization of the Moderna and the Pfizer vaccine, when in more than 30,000 people in both studies combined got the vaccine, and it appeared safe, and it resulted in a 94 to 95% reduction in symptomatic COVID disease. So I'm going through that little bit of history just to also emphasize that this is a regulated process with lots of oversight, and the steps were not skipped. The major difference between this and other vaccine trials that let it move so quickly is that the government invested in manufacture rather than waiting to see once we know a vaccine looks promising and then building the manufacturing capacity. It was built at risk early on, and that greatly condensed or telescoped the process for learning about whether a vaccine protects.
Thanks, Dr. Kotloff. You just walked us through, I think, how a trial works. But let me ask you a follow-up question to that. Were you just testing one vaccine, or were you looking at multiple candidates?
So we tested only one vaccine at a time. So we did the phase 1 Pfizer vaccine, and that's the earliest test of that vaccine. And then we were asked to do the phase 3 Moderna vaccine, and we enrolled about 450 people in that trial. And so our results went to the granting of the emergency use authorization. And now we just started over the holidays testing of a Novavax vaccine. And that again will be a phase 3 trial, meaning it'll be a total of 30,000 people and will enroll probably 400 to 500. It's a different form of vaccine, but we've done each of these one at a time so that we can focus very carefully on how we do each of those trials. And I also, a lot of people say, well, why are multiple vaccines being tested? And why, if we have 2 vaccines that have emergency use authorization, why are we still doing tests? And the answer to that is that you need to take multiple kicks at the goal to score. So you don't want to put all your eggs in one basket. I'm using a lot of sayings all at once, but we want to have a lot of vaccines so that we don't exceed the manufacturing capacity of any one vaccine. We have many more doses of vaccine that way. And different platforms may be more suitable for different situations, and so it gives a lot more flexibility. So we need maybe 4, 5, 6 licensed vaccines to really be able to halt this pandemic.
So, Dr. Kotloff, as I mentioned earlier, we know that many members of our community have concerns around potential side effects, and that this may be the single biggest factor in people feeling hesitant about getting the vaccine. Can you speak to your experience with the side effects in these clinical trials?
Absolutely. So I got to see them firsthand in the people who participated in our trial. And what I saw is that the most common side effects were pain or tenderness at the site of the injection, and also headache, body aches, and chills were another common side effect. Most of these were mild to moderate. They were very rarely severe, depending on the reaction. Most of them were severe and rated severe by the person themselves in less than 2%. They were more often seen in the younger age group, that is 18 to 64, than the older age group, 65 and up. And they were also most commonly seen after the second dose, which is typical of a lot of vaccines, because what you do with the first dose is what we call prime the immune system, and the second dose then has a lot more recognition by our body's immune system and has more inflammation associated with it. So you see more side effects. So it's important to realize that the way you can feel kind of under the weather after a vaccine, and that lasts about 1 to 2 days, is to be expected. It doesn't mean that you actually have COVID. And it will go away in 1 to 2 days. And it leads some people to say, oh, I got the flu vaccine and I got the flu. Well, that's not the flu, and it won't be COVID. These vaccines cannot give you the real illness. It doesn't contain the virus. It's just the price that you have to pay for your body being ready to fight off COVID and protect you from a much more severe illness.
Thanks, Dr. Kotloff. I just have a follow-up question on some things that I've been hearing a lot about. We've heard about these new strains of the virus and the new challenges that they may present. Will the vaccines already approved and those being developed be effective against these new variants of the disease?
So testing for that is ongoing, but what we know so far is that it will not impact the 2 vaccines that are under emergency use authorization, and it's not expected to impact the other vaccines that hopefully will also be publicly available in the near future. Viruses are kind of smart in a sense, and so they're always mutating to try to kind of hide from our immune systems. And So there, it's not uncommon to have some mutations like this, and these mutations are very limited, and so they won't change what the spike protein overall, that's the main component of the vaccine. It really won't change our overall response to that protein. And the vaccines for now are perfectly fine. It is possible that over a much longer period of time, there may be enough mutating that we may need to either change the vaccine a little bit or give it additional doses of vaccine, and we are following along very carefully to see whether or not that could ever be the case.
So we have also gotten quite a few questions related to pregnancy and fertility. Dr. Koloff, could you speak to, is the vaccine safe for women who are pregnant or trying to become pregnant?
So these are very good questions, and I know there are rumors that the vaccine could affect fertility, and I think that they stem from the fact that there are proteins in the placenta and proteins in the vaccine that have a similar name, but they have nothing to do with each other. They're not the same, and the vaccine has no impact on fertility. So then the second question is pregnant and lactating women. And the way that we typically test new vaccines is that first we do healthy adults, and then we test the vaccines in people who may be the most vulnerable to the infection in the general community. And so that's why, for example, elderly are then involved in our trials. But until we kind of go through the general population, we don't start trials in pregnant women or children. And those trials will begin sometime in the next month or two. To look and see how the vaccine behaves in those groups now that we know it's safe and effective in the main population. And so for that reason, we don't have specific information, but there have been approximately 13 women who were in the Moderna trial who became pregnant, and there were no safety concerns in those women. And scientifically, there's no reason to believe that these vaccines would harm pregnant women, and we know that pregnant women are at risk for more severe COVID. And so it's recommended by the CDC that if you're planning on becoming pregnant or are pregnant, to talk to your doctor and see whether or not your doctor recommends that you get vaccinated, but there's no scientific reason to think that there would be special problems, and there could clearly be benefits.
Dr. Koloff, speaking of specific groups like our pregnancy, can you talk a little bit about how the Moderna vaccine affects different demographics in different ways, if at all?
Sure. So, the population of the U.S. was targeted for testing of this vaccine because we want to know that the vaccine works in all the populations that we want to protect. And so what that meant is that we wanted to be sure that minority populations were included. And as Dr. Suntha said, about 10% overall of the population was African American, and about 20% was Hispanic, and then there were several percent, I think it was about 5% were Asian, and then American Indians and Alaskan Natives were also included. And then the remainder were Caucasians, and about 25% had underlying medical conditions or were elderly, and the remaining were healthy. And so in that way, we now have information on the population that is at risk for COVID, which is most of our population, but some of the groups that have been included also have increased risk for more severe infection. And we know now that the vaccine effectiveness, efficacy, which is 94%, was similar in all age groups, in men and women, in all race and ethnicity groups. and that the Moderna vaccine showed a 100% reduction in severe illness. So I think that we can all feel good that this is a vaccine for all of us.
So Dr. Kotloff, it's an important point you're making, and another question that we find ourselves being asked is there a difference between the Pfizer vaccine and the Moderna vaccine? Could you elaborate on the exact differences? And then I'm going to put you on the spot and ask you, when it is your turn to be vaccinated, are you going to have a preference as to which vaccine you receive?
So to answer your first question about differences and give a kind of big overall view, the vaccine program in the United States is testing 2 vaccines in each of the platforms that are thought to be most promising. So both Moderna and Pfizer are messenger RNA vaccines, and that means they have a little bit of the genetic code that makes the spike protein, and the spike protein allows the coronavirus to attach to our cells and enter them. And so if you have immunity to that protein, the coronavirus can't attach to your cells. And that spike protein is a component of all the vaccines. But messenger RNA can't alter your genes. It's not even in the same part of the cell. And so it's thought to be a very safe and efficient way of constructing a vaccine. And then I won't go into the 2 other types of vaccines that are in clinical trial now. So the difference between the Pfizer and the Moderna vaccine is very, very small. There's a little bit of difference in the part of that spike protein that the messenger RNA makes. The Pfizer vaccine requires ultra cold storage, deep freeze, and the Moderna vaccine is stable at a little bit higher temperature. They have pretty much equal safety and protection profiles, so they're just as safe, and they're 94 to 95% protective. The Pfizer vaccine is given as 2 doses 21 days apart. The Moderna is 28 days apart. And one thing that's important, even though they're so similar, they're not interchangeable, and we don't have any information on whether you can have 1 dose of Moderna and then followed by 1 dose of Pfizer or vice versa. So you should stick with the same vaccine. Whatever you get first, you should get second. And then would I choose one or the other? So I was happy that I had vaccine available to me. I believe very strongly that vaccines give health equity because they're available to the entire population, even if it's stepwise in this circumstance, and you can prevent disease rather than have to get the disease and treat it like treatments do. So I could not wait to get a COVID vaccine. And it was an absolute thrill and meaningful experience for me to work very, very hard with my team for 4 months to provide the information that was necessary for these vaccines to get authorized under emergency use. And I was completely thrilled to be able to be vaccinated on Monday, I have to say. Thank you.
Well, Dr. Kotloff, thank you. On behalf of all of us, our communities, our nation, and in fact, our international community, thank you for all of the energy and effort that you and your team have put forward to helping us get through this pandemic and beyond it. Now, before we leave this conversation, I want to share a quick video with everyone. You may remember last time we were together, we spoke to Shawn Hendricks, who was amongst the very first medical system employees to receive a vaccination on December 14th. This week, she and several others received their second doses, passing yet another exciting milestone in this effort. It was an emotional moment to be sure, and Shawn and a few others were generous enough to let us capture it. Let's take a look.
Guess what?
I get a vaccine.
Still stick. Well done. You did great.
Yeah.
It was as good as the first. No problems.
The second shot means for me the safety of myself, my family, my co-workers, and my community.
Ironically, I just literally left an ED shift where I was caring for COVID-19 patients downstairs to come up to get this second booster, and it's a feeling of elation.
People I come in contact with now, they getting it. They see I don't have no effects of it, so they getting it. So.
This will start letting us do more things, get back to a normal life, hopefully.
Just get vaccinated.
We do not yet know exactly when our lives will go back to normal. But we do know that getting this vaccine to as many people as possible as quickly as we can is the single fastest way for us to get there. So as we begin 2021, it seems impossible that it's been less than a year since this all started. It has not been an easy year, and it certainly has felt longer than it actually has been. But now we begin anew with hope in the form of these vaccines. I'm sure you will all have to step up in some way to help your families and your neighbors during these trying times. And I know that you'll continue to do so. But we've learned a fundamental lesson that's reminded us all that we are stronger as communities together. The best way to continue to keep yourself, your family, your neighbors safe and healthy is to wear your mask, wash your hands, stay physically distanced from each other, and of course, when your time comes, get vaccinated.
Thank you, Dr. Santa and Marcosi, for leading this engaging conversation, sharing with us more information about the COVID-19 response. I'd also like to thank Dr. Kotloff for an extremely informative and encouraging discussion around the COVID-19 vaccines. And thank you to all of you who joined us today. We hope that you will stay connected. You can find our social media channels displayed on the screen. You can sign up for health and wellness emails at umms.org/email. You can also find more information about the COVID-19 response at umms.org/COVID. Finally, please remember that you can call our free nurse call line anytime, day or night, to discuss your concerns or possible symptoms. You can reach the nurse call line at 1-888-713-0711. We are grateful for everything you are doing to keep yourself, your loved ones, and our community safe. Have a great weekend.